Okay, we're alive. We are alive. Good morning.
Morning.
Good morning. Good morning to everybody watching on YouTube since we are live.
Good morning.
Good morning. We're just waiting.
I have my coffee, now I can talk to you about sleep.
Okay. Okay, how is everybody feeling today?
Well, it's a rainy day, and your topic is about sleep, so I think we all want to go back to bed.
Okay. Perfect.
I feel very sleepy.
Perfect. Well, like I said, I usually choose a topic depending on what I come across during the week. But for me, I think I want to talk about the sleep because sleep has been personally affecting me right now. Right. It's not that sleep is affecting me; it's the lack of sleep that is affecting me. So I would like to talk about a topic as how mindfulness meditation helps to improve our sleep. So, it's the science behind mindfulness meditation that helps sleep. So, who in amongst us have had problem with sleep, whether you cannot fall asleep easily or you cannot stay asleep throughout the night.
I had like waking up like at 3 in the morning.
Why? So waking up at 3 in the morning.
Why do you wake up like at 3 a.m.? 2 or 3 a.m. Why? I don't know, but I just say a little prayer and go back to bed. Because you are hungry, or I get up and go to the bathroom, whatever. Yeah. So sometimes nature calls and you have to get up and go. So.
Yeah. Well, let's just talk about different reasons why someone would have problem with sleeping. Why do you think they lay there awake at night and cannot fall asleep?
Liver stagnation.
Liver stagnation, and how does that affect the sleep?
The liver, it detoxifies at night in the early morning hours, and a lot of times people's sleep gets disturbed because the liver's not able to do its job.
Yes.
Of detoxifying, so it wakes them up.
So not detoxifying, affecting the brain cells, right? They get sick. They are affected by the toxins, so they don't work well. All right? Yeah. Okay. What else? What else keep people laying awake at night?
Because of stress.
Stress. Yes.
Mind busyness.
Mind business. Well, we call that a monkey mind, right?
Monkey mind.
The monkey mind is too active. What else?
Drinking a lot of water before sleeping will cause you go to toilet multiple times.
Yeah, so that disturb your sleep during your sleep. So you have to wake up to go to the restroom. Yes.
Stress.
Yeah. So we mentioned
like
stress.
A stressful situation that you're in.
Yes.
Might wake you up.
Well, yeah.
What else?
Anxiety, right? Anxiety. That's anxiety.
Yeah, not drinking too much water, but drinking too much
wine,
caffeine.
But I want to stay awake during meditation.
Yes, yes. So drinking too much caffeine or consuming stimulants, right? Consuming stimulants. What else keep the people awake at night?
Studying or working.
Studying or working, yes, people who, well, I mean, we're talking about the problem of laying in bed awake and cannot fall asleep.
Pain can be also
Pain,
a reason.
yes, pain.
Body
Yeah,
pain.
I have a gentleman who has a lot of heartache pain, and I said it's not good for you to fall asleep at 1 or 2 o'clock in the morning. But then he said, "But Dr. Tran, this pain is what keeping me awake."
How about taking painkiller?
Take-
What?
taking
Painkiller.
painkiller?
Well, those could put you to sleep for sure.
Yeah, but
Not necessarily, though.
in some people it has paradoxical effect on the body, and the people cannot go to sleep because it has the stimulation effect on them instead of calming effect.
Well, after my accident, for 9 years, I had pain day and night, and I couldn't sleep because of the pain, as Hal mentioned.
Right.
Pain,
Yeah.
nonstop, off the charts. It will keep you from sleeping.
Right.
Well, and a corollary to that would be ADHD medication. I guess that's a simple
Medications can keep you awake at night. Yes. Some medications keep you awake at night, and some medication make you feel so sleepy, so they help you to sleep. Okay. So what else?
Full moon.
Full moon, yes. Full moon.
Well, we have that now.
Frequencies, right? External frequencies that affect your cellular function.
Schumann resonance.
Human resonance?
Schumann resonance.
Schumann. Okay, can you
The
explore on
earth
that?
frequency, the Schumann resonance can get disturbed.
Yes, yeah. Okay.
I don't know what that is. Can you explain?
Huh? So storm at night.
Storm at night. Okay. Well,
Lightning or whatever can keep people staying awake at night.
Woke me up last night.
Yes, yeah. And what else?
Maybe noise from neighbor.
Noise, external factors. Yes.
Cats jumping on your face.
Cats jumping on your face. Yes. Or dogs jumping on you, right? So a lot of other things.
Oh yeah, barking
Now,
dogs. Yeah, we've had that.
Okay, so you know those are the reasons why someone may have problem with falling asleep and staying asleep. How do you help someone who has sleep problem?
Darken the room.
Yes, so darkening the room, so stopping blue lights from entering your eyes at night.
Eliminating
Reducing.
EMFs.
Huh?
Eliminating EMFs.
Eliminating electromagnetic field frequency affecting you. Yes.
Turn off Wi-Fi.
Turn off the Wi-Fi.
Well, some people will go to bed with their earbuds and listen to things, right?
Yeah, so don't listen to things or,
Well, I'm not saying
or watching video that have, stimulating effect.
I think the best way to improve your sleep is reading the book you don't like.
Reading the book you don't like to read. It makes you fall asleep, okay.
White noise. Some people use white noise.
Some people use white noise like me, right? So sometimes I put on meditation music or,
Cover up the snoring.
Yes.
Yeah.
What else?
Sleeping with cats or dogs.
As a way to go to sleep or a way to stay awake?
Because the dogs and the cat can disturb you when you sleep, though.
Yeah,
Right?
that's usually what happens.
Looking at the sunrise, watching the sunrise for 10 minutes in the morning.
Okay. So watching the sunrise for 10, actually the research shows that it has to be at least 15 minutes. And on the cloudy days like that, like today, you have to do it for more than 15 minutes. It could be 20 minutes.
So watching the sunrise makes you sleepy?
so
Stimulates melatonin production
yes.
at night.
Early in the morning, early morning sunlight, not midday sunlight.
Never heard that before.
This is scientifically proven, so
Wow.
you go out when the early morning sunlight.
Oh, to reset yourself. Is that the idea?
Circadian
Yes,
rhythm.
you reset your circadian clock.
Okay.
So the light from the sun is not the same from morning till night. The
Oh,
frequencies, different frequencies. So, the range of colors, right? You have the spectrum of colors in the light that changes constantly from minute to minute to minute, from second to second. And so early morning sunlight and at sunset, at sunset, the frequencies of the light entering your eyes are different to the frequencies of the light that enter in your eyes at noon.
Yeah,
right?
UV light is very prevalent at noontime.
Right. So early morning sunrise, sunlight, and at sunset. If you go out there and just look up at the sun and allow the lights entering your eyes, that light frequency is going to stimulate the cells at the back of your eyes to release melatonin, or to make and release melatonin and other chemicals that go straight to your brain from the eyes, that go to your brain, and also that goes to your gut. So it activates your gut-brain connection as well. That improve your, production of melatonin at night and other hormones, other peptides, other signalings in your body that help you to fall asleep easier. It resets your circadian clock gene. So in our gene pool, there is a gene. It's called clock gene. There's a gene that is called the clock genes, and the activity of that gene will determine how good your sleep is and your circadian rhythm is.
Can eating too late at night also keep your interrupt your sleep?
Can what?
If you eat too much at night.
Eating too much, right? So that's why you should not eat too close to your bedtime. It messes up your metabolism.
so what is the best time to sleep at night?
Between 10 and 10:30 p.m. Yeah, between 10 and 10:30 p.m. And then you have to stop using any device that won't allow the blue light. 3 hours, within the 3 hours, right? No, not 2 hours. I think 3 hours is the eating. You shouldn't eat within the 3 hours before you go to bed.
So if you're going to go to bed at 10:30, you stop eating by 7:30.
Yeah, so if you aim to fall asleep at 10 or 10:30, you have to stop using all electrical device, blue light, that can emit blue light at 9 p.m. So after 9 p.m.,
So
no more.
I think we should have dinner around 6 will be the best, right?
Yes, yeah. Before 6 is better.
Wow.
The latest time to eat dinner is 6 o'clock. Yeah. What else? So what else can you do? What else can you do to help yourself fall asleep? Remember, we are in the mindfulness meditation.
Deep breathing.
Deep breathing. Now, mindfulness meditation at night can help or not help you sleep, depending on the kind of meditation that you do. So, if you want to fall asleep, you need to do a relaxation kind of meditation. You don't want to do that meditation to try and focus. When you do a meditation to raise your focus on something, apparently the research shows that it stops you from falling asleep easily when you do that kind of meditation.
So people should actually start planning to have a good night's sleep when they wake up in the morning.
Yes.
If they want the following night to go well, you need to
Start
schedule
working
your
on
day
it in
from
the
the
morning.
moment you wake up.
Uh-huh.
Do heel drops, for a couple minutes first thing in the morning to help move your lymphatic system, do your deep breathing, gaze at the sun in the early morning,
Right.
and then in the evening, night, the sleep will come easier.
Right. Yes. Yeah. So, back to the mindfulness meditation. How do you think mindfulness meditation helps sleep?
Relaxation.
It relaxes you, yes. What else?
It helps the vagus nerve.
Well,
Different breathing.
if you activate the vagus nerve by deep breathing, if you just meditate without deep breathing, can you fall asleep easily? If you do a relaxation and just lay there and listen to sleep, relaxing music or something.
Oh, I think you can.
You can, but it's not as effective. The magnitude of the effectiveness is high, higher if you do the deep breathing with your meditation, right? Because you activate the vagus nerve. Okay. So how else does mindfulness meditation help you to sleep?
Releasing stress.
It releases, calms down the stress response.
I think sometimes something can happen during the day where you get angry and that preoccupies your mind.
Mm-hmm.
You have to use the meditation practice, especially forgiveness. Get past that.
Mm-hmm. So remember, we just went through the reasons why someone cannot fall asleep. Now apply mindfulness meditation to those reasons and say, does it help you with the calming your monkey mind? It does, right? Does it help you to reduce your stress? Yes, it does, right? Does it improve your melatonin production?
If you're looking at the sunrise, I guess.
Yes, but we're talking about how does mindfulness meditation help you to sleep? So if we know the reasons why someone cannot fall asleep, you go back and you ask yourself, can mindfulness meditation help to resolve those reasons? So do you think mindfulness meditation help to release stress? We knowing that stress is causing someone to not be able to fall asleep.
Cortisol's another problem.
Yes, so hormonal, right? So hormonal imbalance can cause you to not be able to fall asleep at night. Too much of cortisol level in the evening, right?
Where does cortisol come from?
Cortisol comes from your adrenal.
What does it do?
Sympathetic. Cortisol is the stress hormone.
Oh.
People, in in an acute stressful situation, cortisol release is heightened.
Oh, that's the fight or flight syndrome.
Fight or flight, okay. Yes. But when you are constantly in chronic stress all the time, what happens is that initially your cortisol level will be high, but after so many months and so many years of being in chronic stress like that, in constant fight or flight, the adrenals get tired of producing cortisol. You get adrenal fatigue. So cortisol level drops down to below normal range. So too high cortisol, too low cortisol are both indications of stress. Yes, acute stress and chronic stress. So can mindfulness meditation help you to correct your hormonal system? Absolutely it can, right? can mindfulness meditation help you to increase the production of melatonin? How? We talked about this.
Well,
Where does melatonin get?
it gets
produced?
released, you said, by the back of the eye to the brain.
Yeah, so by both but which organs produce the most melatonin for you? The gut.
Oh.
The gut produces the majority of your melatonin, and then a small amount of melatonin is produced by the cells in the eyes, by the brain, and even skin cells. People who go to the sea and be out in the sun, they sleep better at night, right? Right. But so how does mindfulness meditation improve your melatonin production? It works on the brain and it works on the gut. The two organs that produce melatonin, right? So if you improve your gut health, if you improve your gut microbiome, your melatonin will be produced. What else? A lot of hormones and peptides are being produced by the gut cells also, right? So that when you do the deep breathing exercise to activate the vagus nerve, and the vagus nerve releases signals to the gut to improve the gut health, that is going to help your brain health and your sleep, right? And also it helps your hormonal system too. I know women in menopause, they have problem going to sleep. Why? Because they don't have enough progesterone, which is the hormone that helps them to sleep.
So how do they get more of that? How do they get more of that?
They just have to, take hormone replacement if their body cannot produce that. But if they can improve their overall health, they can hopefully improve the production of hormones. But menopause is menopause. Menopause is when your ovaries no longer produce sex hormones, or produce very little hormones. So you can do things to hopefully, stimulate your ovaries to produce some hormones. But, postmenopausal women tend to need hormone replacement therapy to help sleep. But sleep affects all of the other systems in your body. Name the system. What systems do you have in the body? The immune system, the hormonal system, the digestive system, the cardiovascular system, and the nervous system.
Skeletal.
And the skeletal system, right? So think about these systems and think how mindfulness meditation can help them. But first of all, think about how lack of sleep is going to affect these systems. Do you think lack of sleep affect only one of them or all of them?
Well, if you're tired, your whole body is tired.
Yes.
So
Sleep affects all of these systems. Because sleep is when the body goes through detoxification and repair. If you don't have enough sleep, what happens? Oh, it affects the metabolism to the gut, right?
well, your body does get repaired.
Yeah, so when you don't sleep enough, your body cannot go through detoxification. What happens?
Toxins build up and you get sick.
Yes, toxin builds up in the body and the cells get sick due to these systems. And for one example, okay, so if you don't get rid of the metabolic waste called beta amyloid, okay, if your body doesn't get rid of metabolic waste, take one example of the beta amyloid. Dementia. That buildup of beta amyloid is going to get deposited in the brain, and then you get dementia, right? So dementia doesn't happen after 1 week of lack of sleep. It happens after many months and many years. So your risk of dementia goes up because you have lack of sleep when you were younger. And people don't realize that. Younger people now, college students and young people working, they don't go to sleep, and they don't realize that what they're doing in their younger years is actually increasing their risk of bad health when they get to be older in their 50s, 60s, and then by then it's too late. It's so hard to get rid of that beta amyloid deposits in your brain by that time.
So what's the minimum amount of sleep you should be getting throughout your life?
The minimum amount of sleep per night is 5 to 6 hours. People say 8, but you can get really good quality of sleep for about 5 or 6 hours and still do well. If you get 8 hours sleep and it's not good quality of sleep, it doesn't mean much.
Like sleep apnea.
Yes, sleep
prevents you
apnea.
from getting into detox.
Yes, sleep apnea is huge. Sleep apnea affects the overall health in so many ways and so fast.
And it's an epidemic in this country.
Yeah, people some people don't have sleep apnea, but they like a lot of my patients with chronic fatigue syndrome, they sleep like 10 hours, 12 hours. But when they wake up, they don't feel refreshed. They don't feel rejuvenated. 10 hours of that kind of sleep is not the same as 5 hours of really deep, good quality sleep.
Obesity affects your sleep.
Obesity affects sleep. How?
Because it's a lot of weight, a lot of heaviness that causes oftentimes sleep apnea.
Yeah, sleep apnea.
A lot of pressure on the organs, so
right.
they can't get the blood flow they need because
right.
there's so much inflammation.
Inflammation is another thing, right?
So the capillaries can't get the blood flow they need.
Yeah. So the adipose cells, which is the fat cells, the medical term for fat cell is adipose cells. And the research shows that the more adipose cells you have, the more inflammatory markers you have in your body. So people, there are studies that show that people who are overweight have elevated CRP, quantitative CRP, C-reactive protein, which is an inflammatory marker, and as well as cardiac CRP, both are elevated. So people don't think obesity is an illness, but it's an illness that leads to many other illnesses. It's the root cause of many problems. And we have an epidemic in this country, right, of obesity. So lack of sleep affects the immune system, the hormonal system, the gut system, the brain system, what other system? Cardiovascular system. So blood pressure goes up. People who don't sleep well have high blood pressure, right? And the skeletal, how is it that it affects the skeletal system?
Well, when your cortisol levels are up, you tend to have osteopenia or osteoporosis because there's more catabolic process going on in the bones and it's not rebuilt.
Yes, yeah. So lack of sleep can lead to osteopenia or osteoporosis, right? Like Rafaela said, the high cortisol level has the same side effects as taking prednisone all the time, right? And we know prednisone causes osteopenia and osteoporosis. And people don't think that, oh, lack of sleep is the cause of my osteopenia and osteoporosis. And people think they can fix their bone health by just taking vitamin D and calcium. Doesn't make sense. You treat osteoporosis with comprehensive approach, not fragmented approach, right? And then and during sleep, what is being produced that help your skeletal muscle system is the growth hormone. During sleep is when you produce growth hormones the most. You don't produce that during awake state. But growth hormone has different isotypes. So the hypothalamus will produce different isotypes of growth hormones that go and work on different organs. There's many different isotypes. People think there's only one growth hormone. No, there's different types of growth hormones, and they have to be produced to work on your different organs. So in kids, growth hormone make them grow taller. In adults, it doesn't make you grow taller or bigger.
And kids require more sleep, right? That's why we get naps. Is that true? I mean, kids require more sleep? That's why they get naps?
Well, no, everybody actually needs a nap. The research shows that, adults also need a nap in the middle of the day. Adults who have naps in the day do better than adults who don't.
So how long should we nap?
Half an hour? 15 minutes helps, 10 minutes, but you have the best half an hour.
So like right after lunch?
After lunch, yeah. After lunch, actually.
That's great.
No, after lunch, I would recommend, half an hour. You can't really go to sleep immediately. That's no good, right? Sleep is for relaxing. So you have to stay awake to allow the gut system to work. So sleeping right after a meal is not a good thing for digestive function or anything else. But well, if you put all the research together, we have to get on with our practice. But if you put all the research together, if you eat a meal, they say that the best time to go and exercise is half an hour, and you only have to do 10 minutes of exercise to get all the health benefits. So you eat and then you rest, stay awake for half an hour, and then you go for a gentle walk for 10 minutes. Even 10 minutes is going to help you in a lot of ways. And then after you come back, you relax, and then you can go for a nap after that. So now that we know how mindfulness meditation can help in so many ways, in so many systems, we know why it is such a valuable skill to practice, right? It's like killing many birds with one stone, targeting many systems in your body with one practice. So why not? Why not? So I really encourage everybody watching this episode to put more effort into practicing mindfulness meditation on a daily basis if you can. It's such golden, it's such valuable skill that money cannot buy. Okay, so with that, I would like to invite everybody to practice half an hour of mindfulness meditation with me.
I thought we are going to have like sleeping.
You can do too. You're welcome to get a mat and lay down and practice meditation while laying down. You can practice mindfulness meditation while sitting up, while standing at the kitchen sink,
Are you trying
or
to lie down
while
today?
walking in the park. So meditation is not all about sitting down in the quiet room and turn off all the sound, right? What is the definition of mindfulness meditation? We talked about that last week. What is the definition of mindfulness meditation? Because if you don't know the definition, then how do you know that you are practicing it correctly?
Actually, go first.
Well, Hal should know it by now because he's been in this class for about 3 years now.
How's your master? You are a master.
Apparently not, because I'm not remembering the definition.
So, mindfulness meditation is a practice of raising awareness in the present moment about yourself and your surroundings without judgment.
Without
We need to put
So
that
the
up.
components of mindfulness meditation are what? Raising awareness.
Yes. Raising awareness.
When? In the present moment.
Without judgment.
Without judgment. That's it. Awareness of what?
Right, what's around it.
Yes,
Of
right.
yourself and your surrounding. Right?
Yes.
And then you explore a little bit deeper. What is it about yourself that you want to raise awareness of? The 6 senses. What are the 6 senses?
Hearing,
Eyes,
Smelling, hearing,
nose,
tasting,
nose,
ears,
touching,
touching,
thinking.
thinking. Right? So
Feeling.
tasting. So
Feeling.
go down from top to here. Top is the mind, right? So that's your 6th sense. Mind, vision, eyes, smell, nose, taste, mouth, and speak. Speech,
Hearing.
right? We talked about mindful speech, hearing. So we talked about the sense of hearing and mindful listening and touch, right? And then your surrounding. Are you aware of what's going on right now around you? And not only that, you dig deeper. So you go deep into meditation, right? At the beginning, you raise awareness about your 6 senses, and then the awareness of the surrounding, and then the awareness of how you react with that. How you react with that. And then deeper is how you make decisions to make changes. Right? Okay? So mindfulness meditation is the practice of raising awareness of yourself and your surrounding in the present moment without judgment. And what is the basic tool that helps us to get into our meditation?
Breathing.
The breathing. So why don't we just start to take a few deep breaths in and out? And how you breathe is important because you want to make the best, right? You want to get the best benefit out of the breathing. And the technique of the breathing is what? Slow and deep. Breathe in slowly and deeply, then hold, and then the out breath need to be what? Longer than the in breath. That's it.
That moves the lymphatic flow too.
Yes, it moves. Yeah, it activates the vagus nerve and it moves the lung cells, the heart cells, and everything. You know, make it into a good rhythm. So if you have good rhythm, it's good for the body. If you breathe fast and shallow, what does it do? It activates your sympathetic nervous system. And you build up toxin, you don't have time to breathe out all of the carbon dioxide. Right? Okay, let's take a few deep breaths in and out, and you can close your eyes or open your eyes, whichever you prefer. Start focusing your attention, awareness on your breath, so that when you breathe in, you know exactly how you breathe in. And when you fully inhale, you hold it for a few seconds. Not too long. If you're not used to holding your breath, you can pass out if you hold too long. And after you hold your breath for a few seconds, you breathe out lower than you breathe in. Breathing in, we know how we are breathing in. Breathing out, we know how we are breathing out. Focus on your breaths for the next 3 or 4 breaths. How is your breathing? And once your breaths are in the rhythm and you feel comfortable with your breath, start raising awareness on your senses, going from the top of your head down to the toes. Work on your senses. Is your monkey mind inactive? Just see things for what they are without judgment. And be with your senses. are you seeing? What are you smelling? What are you hearing? What are you tasting? What are you thinking? What is your state of being? Right in this present moment, do you know what's going on in your body? Do you know how you feel? Do you know how you think? Just see them without judgment. Be with them. It's okay to see that your monkey mind is active. There is a saying that someone said, I am not my mind. I am the one who is observing my mind. Continue to take deep breaths in and out, slowly and deeply, as you observe your six senses. How are you interacting with your six senses and the subject of your six senses? Are you being judgmental or non-judgmental? Breathing in, we know we are breathing in. We are in the state of awareness. Breathing out, we know we are breathing out. How are you in this present moment? Are you aware of your state of being? Are you being kind to you, your body, or are you being judgmental? Are you seeing things for what they are, or are you seeing things with an opinion? When you are seeing things that you dislike, how do you react to it? Are you seeing them for just what they are, or are they causing you some discomfort? Or are they causing you to have some reactive judgments and feelings? Are you able to just see them for what they are and let them go by? Continue to take deep breaths in and out. In, I know I'm breathing Deep breath in, low breath out. In this present moment, are you aware of all of your organs working for you. You can practice some gratitude towards them. Thank you, eyes, for giving me sight and vision. Thank you, nose, for allowing me to smell. Thank you, mouth, for allowing me to speak and taste. Thank you, ears, for allowing me to hear. Thank you, skin, for allowing me to feel. Thank you, mind, for allowing me to have awareness of my thoughts. Thank you, lungs, for allowing me to breathe and detox. Thank you, heart, for working so hard to deliver blood to the rest of my body. Thank you, gut, for the perfect digestion and absorption of nutrients, also helping me to get rid of waste products. Thank you, liver and pancreas, for the metabolism, the detoxification, the digestion. Thank you for working so hard 24 hours a day. Thank you, the adrenals, for allowing me to respond to stress. Thank you, the kidneys, for helping me to getting rid of waste products and also preserving nutrients. I know my kidneys are constantly reabsorbing nutrients and electrolytes and only remove waste products in the urine. Thank you, my sex organs, the ovaries, the testes, for working hard all the time to balance my hormones. Thank you to the bones and the muscles, the skeletal organs that allow me to move and to feel and to be strong. Thank you, this whole body that gave me life. And I promise, and we all promise, to do our best to take care of this body that is trying to work very hard to give us a beautiful existence. With this state of being, in this state of awareness, we promise to ourselves to be always grateful for what we have and take responsibility for our own body, for taking care of them. And we realize that we cannot be ignorant of our responsibilities to our own health. This present moment of raising awareness of ourselves and our surroundings helps us to see what needs to be done to give ourselves the best mental health as well as physical health. And that we have to make time and effort to preserve it. With a healthy mind and a healthy body, we can enjoy life and make life more meaningful. Deep breath in, slow breath out. Through the practice of meditation, we will see the power that we have to transform health, transform the mind. That power will grow with the practice that we put in. It does not come out of the blue, out of thin air. Through the practice of mindfulness meditation, we will see that we practice not just for ourselves, but also to help others. Cannot help other people when you don't have the skills. Just like you cannot give orange when you don't have an orange in your hand. Breathing in, we know we're breathing in. Breathing out, we know we're breathing out. Oftentimes it is so easy to talk about the benefits of mindfulness meditation, but to experience the benefits, it needs practice. Breathing in, I know I'm I'm breathing in slowly and deeply. I'm breathing out. I know I'm breathing out slower than I'm breathing in. For the next few minutes, I invite you to practice in silence. Breathing in, you know you're breathing in. Breathing out, you know you're breathing out. In, you know how you are in this. Out, you know how you're surrounded. the next few deep breaths in and out. Return to yourself, return to this present moment, and return to this room. Open your eyes, move your fingers and toes. Or continue to sleep.
Well, you got your 15 minutes of sleep in there. Meditation.
Yeah, sleep meditation. Okay. All right, so that was half an hour of meditation practice. So we can do some
improve my sleep.
stretching, yeah, or massage. So you can do massage if you want to massage your head, massage your ears, massage your neck, pamper yourself, massage your upper back, your arms, your elbows, your hands, your fingers. The fingers and the toes are constantly doing their job for us, but we don't really give them some love. When you give them love, suddenly they feel better. It feels good. Yeah. And massage your back, your hips, your thighs, your knees, your calves. Give your toes and your feet.
Now I think we should have a meditation class at 9 p.m. before sleeping, right?
Well,
And then
our teacher would have to be home by 9.
And then we just go straight to our room.
So what you can do is you go to YouTube and replay this and practice along with it before your bedtime.
No, I mean, like, if we have like the meditation class like this, everyone to talk.
I want a live instructor.
Yeah, so I like at 9 p.m. and then we just go straight to sleep. That's awesome.
Yeah. All right. And do some stretching, and we will do 4 rounds of walking meditation. Well, I feel pretty good.
I feel
Feel
sleepy.
refreshed. Yeah. You still feel sleepy?
Yeah.
Maybe you stay up too late at night.
No.
No?
Wow, the meditation like give me the effective for my sleep right away.
Right away. It helps you sleep right away. Okay.
I got to follow you because if I don't,
You
I'll
follow me?
take a lap on me.
Okay. All right, we switch. So remember, you can meditate as you walk. We call this walking meditation. So deep breathing and raising awareness. Peace in every step. There's the book written by Master Thich Nhat Hanh with that title. forget to take deep breaths in and out. One more round. Okay. So let's share our experience of today's session.
Well, I thought it was a great topic.
Great topic.
Yes,
topic.
because it sounds like
Sleep.
we're going to have
Yeah.
the discipline to get home early. And get to bed early,
And
not,
get up early.
not be playing on our phones before bedtime. I'm looking forward to that.
Yes. Remember, yeah, quality over quantity, but we have to have a minimum quantity of sleep. So,
How about the tech? How about the exam?
Exam?
Yeah.
A sleep exam? Okay.
I mean, like for example, if I like have like an exam tomorrow, I have to stay awake to
Oh.
study. Otherwise, I cannot pass the test.
Well, I think.
Study in advance.
Oh yeah.
so talking about life circumstances and habits, right? So
Don't
when we
procrastinate.
no, don't procrastinate. There's a lot we have to work on ourselves. There's a lot, but like for me, I know sleep is good. Sleep is important. Not staying up late at night, but the circumstances doesn't allow me to have all of that if I continue with this current lifestyle. You know, my job, my training,
Yes.
everything. How many years of it? And I know if I don't change it and reverse it pretty quick, you can reverse it if you do everything.
And you are changing it. So
You
that's,
can reverse the damage. And as much as I feel, you know, for my patients, I have to make that change. It's about time I have to focus on my health and not continue this lifestyle of working until midnight and having
working until then.
4 or 5 hours of sleep and go with the stress day after day. Well, you know, I don't have that many years left, right? I'm almost 60. Very close to being 60. So I need to do what's right for my health and for my family as well. But it means that every single one of us at some time in our life need to look at our lives and make the decision. And sometimes it can be a hard decision to make. You know, it is a hard decision for me to make, knowing that a lot of my patients will have to look for care somewhere else. But I've got to make that.
Well, it's also true that nature, what is this? Nature abhors a vacuum, right? So when people leave a practice or leave this world, they're missed, but they can be replaced. There's always someone
Yeah.
who's over the
Yeah.
So,
Yeah.
and that's certainly going to be true of your patients. But the better news is that you're going to be serving a whole bunch of other patients in a way that's not as stressful for you. So that's good.
Yeah. But I would like to share something that proves that true healing is when you don't rely on medications, right? True healing is when you feel good and healthy without a single medication. A lot of us go around, for example, saying, oh, I feel good, but then they go home and they take about 10 medications to keep them feeling good, not knowing that those medications can actually shorten their lives because of their side effects, right? So we have, Nick and Rafaela have not met Rebecca yet. Hopefully one day she will come back to practice with us. She used to come and practice every single day. I have to say she is my second patient to go into remission because she practices mindfulness meditation combined with an elimination diet. And she has not had to come back and see me in almost 2 years now, I think. Almost 2 years. If I think, yeah. since she went into remission, she doesn't need to follow up with me at all because there's nothing for me to do for her anymore. But she was one of the tough patients for me to take care of because her diseases was so active. And traditional medicine back then, before I went into, functional medicine and cellular medicine, all I knew was traditional medicine, and I treated her with traditional medicine the way I was trained, and I could not get her to feel better. 5 different medications could not, help her to feel completely back to normal. Well, it relieved her symptoms somewhat, allowing her to be somewhat functional, but not better. But so she hasn't been back here for over a year, I don't think. I lost track. But I occasionally will get a text from her, and we talking about happiness and joy in what I do. This text came, and reading it at the end of a long working day make me feel very happy and make me feel like I have a purpose in life. And I would like to share this text that she sent to me a couple of nights ago with you, and I'll read it out. Okay, she said, so because she has not been coming here for a long time, she said this: I have not been hiding, I swear. Laugh out loud, right? Life has been crazy, but I still have hope to get back on Saturdays. So back here on Saturdays, right? I wanted to tell you the great news. I am completely off my antidepressant, Prestige. I credit you and the breathing exercises. Thank you for all you do. I can't believe how many meds I have been able to stop taking. Just a reminder of what I was able to stop taking. Benlysta, Ringvolt, prednisone, Lyrica, Prestige. I think that is it. Laugh out loud. Because of what you do and how you listen to patients, you do what no other doctor I know can do, and that is actually help. So again, thank you, and I look forward to getting my butt back there.
Well, you are a blessing to so many
That's
people.
great.
And
It's
that-
good for
So
you.
that-
It's good news to hear today from Miss String.
So happiness, I'd like to share my happiness
Oh
to
my.
everybody.
So for example, if my stress, if I can recover my health, I'm not allowed to be here anymore, right?
No, no. No, she's been here within the last year. I think she was here.
Was she?
Whatever winter time. It was
I can't remember when the
maybe
last
early
time she
spring.
came back.
Yeah, she and her husband were here.
But then I wrote back because I know she's very busy with life, and she gets to do a lot with her family.
Oh, that's
Like,
great.
For 10 years before she went into remission, she could not enjoy doing activities with her son.
Well, and their family.
Could not do the activities because of the chronic fatigue. Yeah. And now she's living her life, being very active, being very busy, doing activities with her 15 years old son now, and making up for the lost time. And that is living. That is the actual living, the joy in life. And, I hope many and many of my patients will be able to do that and not relying on medication.
We should have a BBQ tonight.
Have a medication night?
No, we should have a BBQ tonight.
A barbecue tonight.
For Miss String, like celebration. Happiness today.
Meat is not my favorite, so
Well,
I prefer eating vegetarian meals. Okay, well, with that, I haven't had Nick and Raphael share your experience yet. How was your experience today, Raphael?
How are you going?
Yeah.
really focused on the extended and optimized feelings and movements that are going on in my body.
Yeah. So you're more aware of what's going on with.
I've always been aware,
Yeah.
but
you're more aware now, you know?
No, I've always been aware. I mean,
Okay.
I know when my liver releases bile, like I'm very aware.
Yeah.
But my body is doing new things,
Mm-hmm.
and it's nice that I am so aware of my body and what happens inside, so that I know that it's happening inside.
Happening. Okay. Yes.
So the changes that are happening, it's very, very encouraging and gratifying to know that things are moving. They're not static anymore.
Right.
They're actually changing. So
that's good.
Huge.
That means that more things are to come. Right. That's just the start.
Every day, more things are releasing and moving, and so it's coming.
Yep, that's good. Great. And how did the session help you? How was your experience, Nick? We heard you snoring.
Snoring? Really?
Yes.
Did I snore?
Yes.
You are kidding,
Almost the
right?
whole time you were snoring.
No, I didn't snore, right?
You did. Go back and listen.
Okay, let me check. Mr. Hao? Mr. Hao? Oh
You were
my,
snoring.
I'm on live stream.
Yes.
Yes.
Did I snore?
Yes.
Oh my, really?
Yes.
Oh my god.
You fell asleep, but that's okay.
Oh my god.
It's okay. It means that you relax. But that means
Everyone all over the world can hear you snoring.
Oh my god, really? You should wake me up, right?
So, well, you know, some people think sleep is a state of meditation, but if you go back to the definition of mindfulness meditation is the state of awareness. So as long as you can be aware of your subconscious mind during the sleep, then you are meditating. But if you're not aware of what's going on, then you are not meditating.
Okay, so not yet.
Not yet.
So I failed today.
Yeah. But some people,
You got the sleep part.
I do believe that.
But anyway, I improved my sleeping today. It's really effective.
Yeah. When you remember your dream, right? When you remember your dream and you know exactly what was going on in your dream, then you are aware in your dream, right?
Okay.
In your dream, you have that awareness, so then you can remember it when you wake up. So in that state, I would say that you were meditating then during your sleep. But that was good.
That's great.
Yeah.
That's a great news.
So I have a question.
Yes.
So I have some friends that say when they're sleeping that they go to different places, like consciously, and they'll like meet up with their children or their parents or whatever.
Yes.
While they're sleeping, and it's an intentional thing.
Yes.
That they're doing, and there's a term that describes what that is, and I can't recall the term, but as a child, I remember when I would sleep, I would fly. And I would fly to particular places in a particular way. And so is that mindfulness sleep when you're doing that, when you are intentionally going to various places or meeting up with someone in your sleep? Is that mindfulness sleep?
I can't really say because I'm not expert. I need to read up on that and see if there's something written about that phenomenon. But I do believe that if you remember your dream in details, then you had awareness of what's going on in that dream. There's certain times when I don't remember my dream, So then I didn't have that awareness in that dream in order to remember it when I'm awake. But so your question is, when you remember your dream like that, is it mindfulness meditation?
No, when you intentionally decide that you are going to go and meet up with someone while you're sleeping. Like say you're separated from a parent or from a child, and you intentionally, and they intentionally go to sleep with the intention of meeting up while you're sleeping.
I can't really comment on that. Yeah, I need to, maybe that's a topic that I can go and read up on it and see what the mind does, what the subconscious mind does when you go into sleep and you know you're going to meet up with loved ones or you travel somewhere. Is that still a dream or is it intentional awareness that you take yourself there? And we know, like I mentioned about the word, I'm not my mind, I'm the one who observes my mind. There, and the master who taught me mindfulness meditation, that is intermediate and master level. When he went into that, he said mind on mind. You have a mind that observes the mind. So we each have two minds, like the subconscious mind and the conscious mind. Or I would think of it as, the mind on mind is the mind that observes the other mind. So which one is a conscious mind and which one is a subconscious mind? It's something that I don't have the full understanding of, and to me, I just feel like sometimes they just, subconscious and conscious switch places sometimes. Like when is the subconscious mind being active, when is the conscious mind being active, when is the conscious mind controlling the subconscious mind, and vice versa. That's a huge topic to go into. Yeah, but it's got to do a lot about the brain wave too. Where is your brain wave? Alpha, beta, theta, and so on. When your brain wave gets at the alpha level, there's only certain things you can do. Then beta and theta, what you can do when your brain wave is at those levels. So if you are not at that level, the theta wave or the beta wave, you can't do certain things. So
Did you want to announce when the retreat's going to be?
we decided we're not going to do the retreat this in August. No, because not many people are coming and people are too busy with summer activities. It's probably not the best.
Maybe September.
Maybe September or October in the fall. Yeah. And hopefully I will have more time. I don't have time right now, this month or next month, so with the practice closing. Yeah. And at the end of August, I won't be able to do a session here because I'll be going to a conference, but I will still be here next week and the week after. With that, I wish everybody a very peaceful, joyful, happy, healthy weekend. Take care of yourself. Namaste. All right.